Thank you for joining us for another episode of the 4NPs podcast. Before we start, we would like to send a huge shout out to the Nurse Practitioner Association New York State, the Nurse Practitioner Modernization Act passed in the New York State Budget Agreement. A quick breakdown of what that means. No practice protocols need to be filed for quote-unquote junior NPs anymore, and NPs with more than 3,600 hours of experience do not need a written agreement or a collaborative relationship as a condition of practice. This is so exciting. Thank you so much to the NPA for all that you do. All of your hard work and dedication has paid off. We truly appreciate all that you do. We are Christina,
Oneida,
Alicia,
Colleen.
Welcome to 4NPs podcast.
This is a podcast by 4NPs. 4NPs, advanced practice nurses, students, and anyone interested in the medical arts.
That's the number 4 NPS podcast.
if you have a topic you'd like to see covered, please feel free to email us at 4npspodcast@gmail.com or reach out to us through our social media.
On this episode, we had the pleasure of speaking with Lauren Knobeloch. She is an NP practicing in the emergency department. She's worked in the emergency department for 15 years. She started as a tech and worked her way up to a nurse practitioner, and she's been a nurse practitioner in the emergency department for the past 10 years. She also created the Nurse Practitioners of Instagram, which is a place where NPs can network and encourage one another. And so far, she's featured over 550 awesome nurse practitioners and NP students. Lauren is a huge advocate for NPs and PAs working together and supporting each other in their professions as advanced practice providers. She also recently published the Pocket Past Nurse Practitioner book. It is a book that contains 1,500 questions and answers for NP students, and actually is very beneficial, as I can contest, for people who have been working as nurse practitioners currently. It's a great book. You should definitely go out and get one for yourselves. We hope you enjoy this episode. We had a great conversation with Lauren. If you didn't have the opportunity to watch it live on YouTube, you can also not only listen to the episode now, wherever you get your podcasts, but you can head on over to our YouTube channel, 4NPs Podcast. And if you like what you hear, please like and subscribe. So today we have Lauren from NPs of Instagram on. We are so happy to have you on. We've been really looking forward to speaking with you and learning all about how you started the NPs of Instagram. And then before we were able to finally have you on, you came out with your book. So we're very excited about learning all about, everything that you're doing. You have your hands full on top of your family. And so you're very inspiring.
Oh, y'all are so sweet. I have been enjoying so much of listening to you guys' podcast.
Oh, thank you.
I was thinking about it when I was listening to it. It's kind of like the NP of Insta's podcast version, because you get to talk to all the NPs and learn about their different specialties. And I've been loving it. And you guys seem like so much fun. I want to come and hang out in person. Y'all are always
totally.
dying laughing. And Christina, I love your giggle on the
oh no
when you're laughing. It's
giggle.
So great.
Thank you. Thanks.
We love it.
Now I'm going to be aware of it.
No, yeah.
Oh, thank you.
So Lauren, yes, welcome. We're so happy you could join us and that you listen to our podcast. That's really an honor. So just to get started, just wanted to ask you a little bit about your journey as a nurse. What made you decide to become a nurse practitioner? Just go ahead, start at the very beginning.
Sure. I'm an emergency medicine nurse practitioner. So I've been in the emergency department now for 15 years, and 10 of those years I've been a nurse practitioner. I always wanted to be, even from middle school to high school, I'm like a lot of people have always wanted to work in medicine or had a feeling like that's where I was supposed to be. And then I think I started watching the TV show ER, and I was like, this is awesome. Is this real life? like, this is like where I need to be. And I loved the character. I think her name was Abby, that was the nurse on the show. I want to say her name was Abby, but I remember the nurse and I was like, she seems like she's like in the middle of the action of everything there. So I loved watching that show. And then when I was a junior in high school, my 2 twin cousins were born, and they were born at about 1 pound and a couple ounces each.
Wow.
And they were in the NICU, and my aunt somehow finagled her way into getting me back into the NICU because I was not of age yet to make it back there. But she got me back there, and this is like a family joke now too. I got back there and I looked at him, and she had just had an emergency C-section too. And I looked at him and I was like, oh gosh, I think I'm going to pass out. And they quickly got her out of the wheelchair. And the next thing I know, she's like leaning on the nursing station, and I'm drinking orange juice with my head between my legs because they were so little. And I was like not expecting what I was seeing, I guess. And so my family still like makes fun of me that they're like, we still can't believe you work in medicine. Remember the time you passed out at the hospital?
Wow.
But I continued to go visit my cousins there, and they had a pediatric neonatal nurse practitioner who did rounds, and that's how I found out what a nurse practitioner was. And then I did more research about what an NP was and did some shadowing in high school, and I was like, this is what I want to do. And so I went to Clemson University and got my bachelor's in nursing. And then during nursing school, I got a externship between my junior and senior year. And one of the rotations was in the emergency department. And I kid you not, I walked into the emergency department and they were coding a patient and it was chaos. And I was standing there and I was like, oh my gosh, it's like the TV show. Like, this is what it's really like. And it's obviously not like that, like 90% of the time.
Right,
but I was
exactly.
like, this is so awesome. This is what I want to do. So after that externship, I got hired as an ER tech. So got my foot in the door. And then my first nursing job was as a ER nurse. So, and then I worked for about 1 year before applying for NP school, and then worked full-time through NP school, and then graduated and got my first job. Some of the ER doctors I work with actually approached me and asked, hey, do you want to come work for our group? Like, I think you'd be great at it. And I was
That's
honored
great.
and shocked. And I was like, absolutely, this is what I want to do. Please, please, please. And so that's how I got my foot in the door. So
Good for you.
yeah. And I have my acute care nurse practitioner and then my family nurse practitioner. And the backstory to that is I thought I just needed acute care nurse practitioner to work in the emergency department. I was a year into my program when I realized I wasn't going to be able to see pediatric patients. And I was like, oh my gosh, like there's only a very few emergency departments that only see adults.
Right.
Like, they want you to see pediatric patients. So I added a year to my studies and added my FNP. So my little tidbit or tip for anybody that wants to go into emergency medicine for an NP is to get your FNP. The acute care is great education background for the acute care management, and I'm very thankful I have that. But FNP is the way to go. It gives you flexibility. If I ever want to like change to something else, I have that flexibility. So I tell anyone that's interested, FNP is the way to go for ER.
That's great.
Yeah.
I wouldn't know that.
Yeah, I did. I learned the hard way.
Yeah. So your school had both programs, the school that you're going to for your NP?
They did, yeah. They had
That's
both
good.
programs. So I was able to, I had to sit with the dean and we had to figure it out, but we figured it out. And then I had to sit for both boards and I keep both licensed. So it's a little bit extra work, but not too bad.
A lot of extra stress sounds like at some point. Yeah.
Oh, yes. And just what you need while you're working full-time as a nurse and trying to go to NP school. And then you're like, oh, I cannot see pediatric patients. That's not a good thing. So,
How long did it take you to get through the NP program?
it was 3 years with summers included, straight through. So,
Okay.
Yes.
Yeah.
That's very impressive, working full
Oh
time.
gosh,
Yeah.
I don't know how, now that I'm a mom, I mean, I just had a boyfriend at the time. I don't know how anyone with any children or a family like could go through nurse practitioner school. And I have so much respect for all the moms that are in school now, even more so making it work. So yeah,
it's a
tough
struggle
for everybody.
but it's worth it. But I think
Oh, yes,
that's amazing that you
absolutely.
were able to do that.
Yeah.
Yeah.
That's great. Now it sounds like you were recruited almost right by the doctors that you had worked with in the ER.
Uh-huh.
So maybe you didn't, but did you have any, like, what were the biggest obstacles that you came across when that role from RN turned into NP? Like, what were the biggest obstacles that you came across?
So the first one, well, most emergency medicine groups are contracted to work in a hospital, and that's how all the ones I've worked for are. And all the ones I've worked for have had multiple emergency medicine sites within a system. So you kind of can float to different ERs, and our group covers them all. So I specifically asked, I said, hey, I love my friends that I'm nurses with, but I am not ready to be like, hey, can you go do this for me? Because they would be like, you go do it yourself, Lauren.
Right.
So like most people, it takes a transition from going to that RN to NP role. And I asked them, I said, hey, can you float me to all the emergency departments except for the one I've been a nurse at for my first year? And they were like, yes, that's like, we could totally do that for you. The other obstacle I would say is learning to how you change your way of thinking, which I'm sure all you ladies totally get. It's completely different. And I think as an ER nurse, I'm just like, okay, let's get the patient out of here, like get them moving. And then as an NP, you're like, oh, hold up, like we got to pump the brakes. Like, what can I discharge this patient home safely, and what is going to kill them that I'm going to miss? Because I got to like make sure I'm not missing that before we let them go home. So, and knowing all the differential diagnosis and the ER, you have to know a little bit about everything is what I like to say. Because you got to know neuro and GI and GYN. And I think today on my shift, I think I like saw all the systems today. I was like, oh my gosh, we are like not focused. We're all over the place. So
it's a great experience though.
Yeah. So, but it takes some time also getting used to like consulting, different specialties. I think you got to learn there's so many different ER docs, and lots of the times they have very strong personalities too. So learning how to work with each of them individually takes some time, and proving that you know what you're doing, and mutual respect, it takes time to build and trust. So
at what point did you feel the shift? Like when you started to feel as respected as the doctors, having been working with them prior?
With the nurses that I knew already, I think it was probably like 6 months to a year. They were like, okay. Like, yeah. So, I mean, it wasn't as bad. I think I built it up in my head more than it probably is. But I've had lots of nurses going to become nurse practitioners that even have messaged me on Instagram, and they're like, how do you deal with this? Like, I just don't know what to do. And I'm like, you just have to get that first year under your belt.
Right.
Be positive, stay focused on what you're doing, and not take any negative comments from anybody else to heart. You just got to go with it. So yeah, it just takes some time, and it's adjustment for the new nurse practitioner, and it's adjustment for your friends who are nurses too.
Right.
It sounds like your facility handled it really well, in that they allowed you to speak up and say, please don't put me on that unit. That would be very uncomfortable for me.
Yeah.
And so
yeah,
I think that says a lot for not only for how they handled you, but also how they handled the nurses. They didn't want to put them in that situation either.
Yeah.
So I think that's good. And then allowing you to gradually kind of establish yourself there in the new role.
Yeah, definitely.
So Lauren, your journey is so different. You're actually, it's different from some of the other people that we've interviewed, in that you said you knew right away you wanted to be a nurse practitioner. And I think the only other person that we've interviewed that said something along those lines was Steven, who's the head of the NPA in New York. He knew he wanted to be a nurse practitioner. Most of the other nurse practitioners that we've met have said that it was like it was afterthought. They were, on the journey to become an RN. And then at some point in that journey, they decided. So that's really interesting that, you're at such a young age, you recognized what that was and you pursued it. You're obviously very, very driven person and dedicated. And it's so impressive to see that. And I know that you are also the Nurse Practitioners of Insta. And I know that we reached out to you in the beginning to say, hey, we love that. We follow you. We see all the new nurse practitioners. It's so wonderful to see so many people. Yeah. I think I didn't really realize how many nurse practitioners there are out there. And it's different. It's cool to see all the different areas.
I know. Yeah.
Yeah. So what was your inspiration to do that? What made you want to do that?
So I felt like in general, I felt like nurse practitioners needed a more positive platform and we need to be supporting each other positively. Yes. And I mean that as even nurses need to support nurses, NPs need to support NPs, RNs need to support NPs. Everybody needs to support each other. We're all on the same team. And one of the things that when I was several years into being a nurse practitioner, I noticed that there was some kind of competitiveness, I would say, between who's better, a nurse practitioner or PA. And it's not between everybody, but there were some people, and it rubs me the wrong way because I am we are here in the emergency department. We're seeing the same patients. We're doing the same procedures. We're getting paid the same. We're working on the same team. Why is there this back and forth between is a nurse practitioner, is a PA better? We took different paths to get to the same point. At least in emergency medicine, that's how it is. And I work with some of the best physician assistants. I love them to death. They have taught me so much. I like to think that I have taught them stuff. We all kind of jump off each other's experiences. And then at the same time, we have a really good group of ER physicians who support we're called advanced practice providers or APPs. That's what they call us in our company. And so we have really good support for the docs. They trust us. They let us take care of our own patients. They're like, hey, if you have something you need to talk to about, come up to me. They're approachable for the most part. And then they also expect us to give the best quality of care. And they give us continuing education all the time. So I just felt like we're all on the same team. I don't like the hierarchy of medicine that there is. Right. So I was on Instagram because I had created my np.lauren account. And I started that to kind of show what it's like to be a nurse practitioner in the ER. And then it kind of grew into me becoming a mom and showing what the heck I was learning about being a mom to how the heck am I going to pump at work during a busy ER shift and sharing that to, I just found this on Amazon. I love it. So I share all kinds of stuff on that account. But then when I was getting all these messages from different nurse practitioners about questions, and I saw this really strong presence of physicians and physician assistants on Instagram, I was thinking one day, I was like, why don't we have a platform on Instagram? There is an account called PAs of Insta. And I was like, man, I really wish there was an NPs of Insta. And then a few days later, I was like, I'm just going to do it. I can do it.
That's awesome.
I can start it. So, and that was my motivation for starting. And I love celebrating PA week just to I just think it's so important for us to build a relationship, positive relationship together. And totally. But then it turned into this platform of networking. Nurse practitioners are networking with each other. NP students are finding preceptors.
That's really
People
great.
are like, can you post me? I just graduated. I am looking for a job. Here's my bio. And then I found you guys on podcasts. And then I got to feature all of you and your wonderful podcast, and I hope
so
that
exciting.
it's helping connect, all these awesome NPs together. And so I don't know, it's just turned in. It's not. I didn't know what I was doing when I was starting it, but it's turned into this like awesome thing and community, and I'm very proud of it. And I hope that it keeps growing. We're at 14,000 followers, and I looked the other day, and I know, right? That's a lot of people.
Yeah.
I looked the other day, and the AANP Instagram account has 300 more people than NPs of Insta, and so I'm like excited to surpass that.
Totally.
Goals. Yeah.
That's wonderful.
It is. So good.
So there's the next question. That's the goal then, right? That's the next goal.
Yeah, I think that the goal is to keep networking. I think it's to keep showcasing how awesome nurse practitioners are. If anybody has more ideas about what I need to do next, I'm like all for it. Just keep growing and keep sharing our awesome profession and careers and building each other up. I just want everyone to build each other up, and nobody knows everything, and everybody knows something that somebody else doesn't know that you can share and learn from. So
that's great.
I just think that's so important.
Yes.
Yeah. You're constantly learning. No
Oh
matter
my gosh,
what, every
yes.
day.
I mean, every single shift, I feel like I go in and learn something, and
Right.
so yeah.
I love PAs too, but I think NPs of Insta sounds way better than PAs of Insta.
I like it too.
Yeah, it's got that ring. It's got that sound.
Although I would be lost I have a PA that I work with, and I would be lost without her.
Exactly.
You talked about what your hopes were in accomplishing with NPs of Insta, and I think it's probably done that for you and more, right? Surpassed your expectations.
Oh yeah, absolutely. I had no idea we would have even 1,000 followers versus 14,000 now.
And I know you kind of went into almost allowing the members of NPs of Insta to kind of guide to what your next goal or how things will look, because we never know, and that's what always is amazing, is that your least expectation or your wildest dreams always happens on accident, like this. And I think it's a great page. I think it's so informative. But do you see anything specific that you really want to gear it towards, or are you just letting it to be open to whatever happens?
I think right now, because my life is so crazy, I'm kind of just seeing what happens. But I would love to promote like continuing education conferences, be a spot where you can kind of navigate what resources are best for your specialty, and make it a little bit easier somehow to help NP students find preceptors. I would love that. But obviously my life is very crazy right now. So that's like on the back burner, but sure, it's like one of my goals and things I hope down the road that'll keep continuing to go forward with the account.
It's awesome.
So yeah, again, just we've all kind of been really inspired by what you're doing, and helping just NPs connect, and just showing the value, even with the PAs that you also feature on there. So it just shows that you kind of have a great, just your intention on bringing the medical community together, regardless whether you're NP or a PA. We do all contribute and can benefit off of helping one another out. So I did want to ask you, out of all of the NPs that you've featured, are there any like really intriguing or unique jobs that you've come across with the NPs that you've met along the way?
I mean, different specialties always interest me to see what everyone's doing. I will say I've learned a good bit more about holistic medicine. I had no idea really what that was. So I've learned from a few people that have been featured on the account for that. And then I absolutely love seeing what people's side hustles are, is what I like to call them. And so if you have like a shop, a Etsy shop or something on the side, or program that you've like created and done, those like unique kind of things have been awesome to see, like what nurse practitioners are doing besides just their job, their role as an NP. So
right.
But yeah, I don't know. And then there's tons of aesthetic nurse practitioners that are really into all their stuff. So I love looking at the before and after pictures of those. I'll go down a rabbit hole real quick on those.
It's amazing, right?
What have you seen as the most common side hustle for NPs?
I would say probably the Etsy shops. Lots of t-shirts, mugs. I don't know.
Interesting.
Cool.
And then lots of people, I've had several people who are like working on continuing education projects. So that's been, that probably is the biggest one. So
Yeah. So we were supposed to interview you, I think, I don't know, a couple months ago, but I'm kind of glad that it didn't work out because in the meantime, you have released a book.
yeah,
Right.
I did.
And I'd like you to talk about it and let us know like what brought the idea to mind and what was the process like bringing the book together.
And congratulations.
Thank you.
Yeah, totally. It's great. It's great. And just what was that process like?
So the book is called Pocket Pass Nurse Practitioner Edition, and I actually was approached by the company. It's called Pocket Pimped, and they initially put out books for medical residents, and one of them was an emergency medicine book. And the word pimped, I didn't know this until nurse practitioner rotations. I know, right? So when you're in a nurse practitioner clinical or rotation, you might get pop quizzes on like, answer this question, like what's going on with this patient? What are you thinking? And so what labs do you need to order? What tests do you need to order? And so that's the pop quizzes that you may get when you're in your clinical rotations.
Right.
And nobody told me about this when I went into NP school. I'm like, oh, I'm not ready for these questions. Like, can you ask me next week when I'm here, please? So anyways, this company put together these awesome books, and they're straightforward questions and answers that medical students get asked. And there was an emergency medicine book they did, and so they sent it to me to look over, and I was like, this is awesome. I was learning stuff just reading it, and it's 1,500 questions, and it fits in your pocket. And they initially did a PA book version for to help PAs sit for their boards and their rotations. And then after that, they approached me and were like, hey, would you be interested in writing the NP book? And I was like, let me think about that for a second. And it's always something I've wanted to do. I just didn't know where to start. And so I was like, yeah, let's do it. My husband was like, this is like a one-time opportunity, Lauren. You just got to do it.
Yeah, what an honor.
Yeah,
sure.
It was probably the worst timing though, because I had my daughter, she was, I had 2 kids under 2, and my daughter was still like, less than 6 months when I started it.
Wow.
And so I was sleep deprived. I was working full time and chasing 2 little ones around. So there is no way I would have gotten the book done if it had not been for my amazing supportive husband. So I'm like so thankful for that. But it's one of my proudest accomplishments for sure. The best messages are the ones I get from nurse practitioner or a student messaging me being like, this is the best book. Like, I can't tell you how much I love it. And it makes all the sweat and tears and hard work that I put into it worth it. With just one comment, I'm like, oh, I'm so happy.
Yes.
Like, I'm happy it's going to be helpful for you, and you're going to be successful in your NP rotations.
Aww.
But it really is. It turned into a book that is great it's made for students, but it's a great review for new grads. If you're going into a new specialty, it has all the different systems. And then also for experienced nurses, it's a great review too. And I found, and then also I'm like running, I can talk about this forever. I made the book, and then I had I think it was about 15 different nurse practitioners help me review it. They each had different chapters. 2 of them are NPs I work with personally, and then the rest of them were ones that I connected on Instagram and through NPs of Insta, who I had featured. So that was just like something special that has come out of the NPs of Insta. So
amazing.
Yeah.
And where can we find your book?
So it's on Amazon, but you also can get it off www.pocketpass.com. Oh. And then there's also an Instagram account that I try to put up weekly educational information on. So there's like x-ray reviews, CT reviews, and that's at Pocket Past NP if you want to follow that too.
Nice.
Great.
So
Okay. And we'll put a link in our show notes, and we'll ask Bella, our wonderful social media manager, to make a post.
Yeah.
Yes.
That's great.
and there's a discount code for this week too.
Yes. What is the discount code?
For NP's podcast
Oh,
for 20% off.
20% off,
Yeah,
guys.
that's awesome.
Might take advantage of that myself.
Thank you.
And also, if we have anybody listening right now on YouTube live, if you hit that subscribe button, we will be giving away a free book.
Woohoo.
Awesome.
Lauren's free book.
Yay.
So, no, Lauren does not have a free book. We will be giving out Lauren's book for free.
Right.
Let's make that very clear. One
Lauren's
book.
free book. Wait, what?
Click subscribe. I was like, wait, that didn't sound right. Anyway, sorry.
That's funny.
Lauren, you mentioned your daughter, your children a little bit. And I know that you are a really big advocate for your daughter. Can you tell us a little bit about the condition that she was born with and some information about it? I'd like to hear that.
Yes. I love sharing about this because I think that if it makes anybody a better nurse practitioner in diagnosing this, it's me worth sharing our experience. And also just from the mom side, if another mom goes through this experience, it warms my heart to be supportive. So my daughter was diagnosed with right unilateral coronal craniosynostosis. So that is a tongue tie. So pretty much she was born with her right coronal suture prematurely fused. And that's kind of where, if you're putting a headband on, that's your coronal suture of your skull. And one side of it was closed, more than likely at birth. It's supposed to close at 24 months old. So in 1 out of 2,500 babies are born with craniosynostosis, and 20% of those are coronal. The majority of them have the sagittal suture fused, and that's the one that kind of goes between your nose to the back of your head. It's rare, but it's still common enough that you probably know someone that's child has had this. So the coronal one is a little bit more rare, so it's a little bit harder, I'd say, to diagnose than some of the other ones. When she was born, I noticed that her right forehead was flat when I was nursing her, and that was my first sign that I thought something was up. But then, like babies' heads are all not perfectly round when they come out. So we gave it some time and it didn't round out. And then her the head circumference wasn't increasing how it should. And it was measuring small. So then I went into my mom gut mode. And I swear, at one point, I was like, these physicians think I'm a crazy nurse practitioner mom, like making stuff up in my head kind of thing. That's where I felt like at one point in this journey. And at 3-month-old visit, her head circumference hadn't gone up. Her forehead was still flat. I had also noticed that sometimes she slept with her right eyelid was slightly open. And she also had infant torticollis. So we were doing all the physical therapy moves, and that wasn't getting better. So I asked for her pediatrician to get some imaging done, and she referred me to the helmet specialist. So most kids that wear helmets, they have a plagiocephaly, which means they have like a flat spot, and they're wearing the helmet for a couple of months to make their head round and shape it round. So if you see a kid with a helmet, usually that's what they're wearing it for. But they do digital pictures there and scans. And right when they put my daughter's face up on the screen, I was like, oh my gosh, like this is not something that's simply going to be fixed with a helmet. Right. So a few days later, we were referred to the pediatric neurosurgeon, who was God sent. I mean, she is so sweet. I would drive across the country for her to take care of my daughter. I mean, even after my daughter's surgery, I walk in and she's like holding Pedialyte and my baby and giving her. I was like, who is this woman? But she's amazing. So,
What's her name?
Dr. Erin Keena.
Okay.
Is her name. She's in the Charlotte area.
That's
She's
great.
going to be like, Lauren, please.
I know. We can put that in the show notes. Though.
Yeah.
That's
Yeah. She knows how I feel about her. I'm very vocal about it. So right after those scans, we ended up going to the pediatric neurosurgeon. We got a CT scan to confirm it, although she already had surgery scheduled for our daughter before we even went to the appointment. It's mainly diagnosed on physical exam. It doesn't typically require imaging, but images that they do order are either x-ray of the skull or a CT scan. And typically they'll get a CT scan done before surgery. Other ways you can, I could not fill my daughter's anterior fontanelle either. It was completely closed. And so that's supposed to close at 2 years too, completely. So that was another sign. Her nose was slightly tilted up a little bit. And then one other thing that you can notice with kids with any of the fused sutures, and my daughter didn't have this, is like a hard ridge along the suture that's fused. Sometimes it's like raised and hard to feel if it's prematurely closed. So those are some signs to look out for when you're doing a physical exam for coronal cranio. So, and then I got a question once. I had a fetal maternal 3D ultrasound when I was pregnant, and it wasn't picked up there. It's very rare to get it picked up on ultrasound in utero. So, and the cause of it is unknown. On rare occasions, there's some other genetic disorders that this also accompanies, but for her, it was just random. So we're very blessed. There's 2 types of surgeries. There's the endoscopic repair. So we were very blessed that she was 1 week away from not being a candidate for that. But it's it was the least invasive surgery. It's only for a few hours and the recovery is quicker. And that's because the bones in the skull are still very soft, that they can still go in, and they actually go in and removed like kind of a pie-shaped about 4 centimeters of her skull. And so you could like touch her head and feel a little bit of squishiness there. Yeah. But the other surgery is called cranial vault remodeling, and it's an invasive surgery. It's like 5 to 6 hours. Oh my goodness. Recovery time is definitely a little more intense. So yeah. And they have a big zigzag scar across their whole head, like a headband there. Wow. So we felt very blessed. And the end outcome is pretty much the same for both surgeries. So yeah, we felt very blessed that she was still a candidate and that we were able to catch it early enough. And then the treatment for it is surgical repair is the ultimate thing you need to do. Then it's wearing the helmet to help shape and mold. So she had to be in the helmet 23 hours a day for 12 months post-op. So we were very happy to kick that helmet to the curb.
I saw the picture.
Yes.
Congratulations.
Yes. So that was like very fun thing to get rid of, because we are going to helmet checks every 2 to 4 weeks to get adjustments, because she's like constantly growing and changing and you can have skin issues with it. Yeah. But yeah. So, and then complications of craniosynostosis would be, it causes increased intracranial pressure. Yeah. If the bone is not released there. And so the brain can't grow if the skull is fused. So it can cause blindness, seizures. Is that what was
happening?
No, hers was all, no, it wasn't happening yet. It usually happens like later on if it's not caught in early childhood. So
yeah, you mentioned her eye, and I just wondered if that was like, if you were seeing very subtle signs of an increase in intracranial pressure?
Oh no, it was her eyelid wouldn't
Just
close
her
all
eyelid.
the way.
Oh, okay.
Yeah,
Okay.
she'd
I
like
thought you meant
sleep
her.
and she'd be like, it looked like she'd be like
Just
winking
one.
while she was sleeping. Yeah, because her eyelid wouldn't shut all the way. Her
okay.
eyeballs were fine. Yeah,
Oh,
thank
okay,
goodness.
okay.
Yeah, yeah, yeah. So, and then it can cause like developmental delays, but when
Sure.
it's treated appropriately, you wouldn't know the difference at all. She is a wild woman. She has no fear. Oh my gosh, she only wants to go down the big slide. I'm like, she's all over the place trying to keep up with her almost 3-year-old brother. They have no fear, so they keep me very busy.
That's so great.
It's a great
Yeah.
outcome. That's awesome.
Good catch, Mama.
Yeah. So I've learned this and especially now being a mom, if a mom is worried about something, you got to stop what you're doing and listen to check that patient out, listen to the mom, trust that mom gut instinct. And I mean, don't cut corners and just assume things too. So
No, for sure. Those moms know their babies. Yep.
yeah.
Yeah. We'll put some information about that in the show notes as well.
Oh, awesome. Yeah.
All right. So we have this is always an important question, I think, because sometimes it could give us some insight, especially new NPs or students. What do you know now as an NP that you wish you knew when you were an NP student or an NP just starting out? Any pearl that you can share?
Yeah. I think that I'm going to kind of focus more on ER because that's what I know.
Okay.
But I think that if you want to be an ER nurse practitioner and just in general, you need to get as much experience as you can possible. I think that at minimum a year of being a nurse at the bedside is so crucial because when you go back to nurse practitioner school, all the stuff you learned about in nursing school, you have seen some of it. And so it makes more sense when you're learning it in a more depth environment in NP school. So get your foot in the door and start working as an RN and see those patients and get that experience. I think that getting rotations, clinical rotations, get your hands on procedures, do things as much as you can as a student. Be that annoying student and ask as many questions as you possibly can. If you do not know something, ask it because you're not going to know the answer if you're not asking someone. And I say this to everybody, we've all asked that question or didn't know the answer to that question at some point in our career. So you got to ask to figure it out and learn. So, and then if you're interested in the ER and want to get hired as an NP out of school, I think that keeping a log of all the procedures you did as a student is important.
It's awesome. What a great idea.
Yeah. So when you go into the interview, you can be like, hey, I've done this lumbar puncture. I've done this many lacerations. I've done this many incision and drainage. Like, I know how to do this. Like, here's what I know how to do. So I think it just kind of gives you a leg up if you're interviewing against somebody else.
That's great advice.
That is.
And then one thing I did as a new grad, I would keep a little notepad with me my first year. And every patient complaint that I had, I would write it down during my shift. And then I would go home and study and learn whatever process or disease I just had treated and managed even more in depth. So the next time I saw that patient, I knew what prescription I needed to write. I knew what test I needed to order. And I didn't have to go ask the ER doctor again another question because I forgot kind of thing. So keeping a little record of that is important. And then, I know I was going to say, since I worked full time, I'm not recommending that for everybody, but if you do work full time as a nurse through NP school, I was able to save money and pay off my debts within 6 months of getting out of NP school. I focused on that. I worked on it. I didn't have really time to spend money because I was at the hospital either working or doing clinicals.
You're a little busy.
So, yeah. But just the life out of school and out of debt, it just is huge. And I just see my colleagues, whether physicians or PAs, and the amount of debt they tell me they have, it gives me anxiety. So I think that's a positive for the nurse practitioner profession. I mean, it's not cheap to go to NP school, but it seems manageable, and we can do it. We can get out of debt and live our lives, and probably making more money than the other people sometimes.
That's great. Yes.
That's great, Lauren. That's such great advice. That's awesome. We thank you for that.
Absolutely.
Truly.
And Lauren, did you have any mentors along the way? Anybody that really, you kind of followed their path, or anyone you want to shout out to and thank?
Yeah, I had some awesome nurse practitioner preceptors. I still keep in touch with almost every single one of them. And I sent a couple of them my book. I'm like, hey, they're like great. So proud of me. So I even invited a couple to my wedding back in the day too. So I just respect them so much. And I am very thankful for the physicians I work with. I can't say that enough. I think it's so important to make sure you are doing what you love, and make sure that you're surrounding yourself with people who are going to be supportive and positive of what you're doing and respect you and treat you as part of the team. And I'm very lucky. I've worked in a lot of different ERs. And so I've been blessed that I've had very good physicians that I work with.
That's great.
That's awesome.
Yeah. Every day they're teaching me something.
Yeah, that's awesome.
And I'm not shy to ask a question. They're like, here comes Lauren. Yep.
That's great.
You're teaching them stuff too. And every time you ask them a question, it's forcing them to think about something that they might not have been thinking about for a while. And maybe they'll, so it's good. Yeah, it's mutual.
Yeah.
Do you ever precept?
Since COVID, the last couple years, no. We're hoping that we're going to be starting to see the students' faces again, or at least mass faces again in the ER. So there's been a pause temporarily. Yeah. One other thing I was going to say is your first job does not always have to be your end-all, be-all job, right? Especially if you're just trying to get your foot in the door in emergency medicine. Just take what you can get at the beginning and do what you can, learn from it. And then there's other places you can go and spots you can fit in too.
That's good.
Yeah. That's more great advice.
Don't be afraid to move on if that is what life presents to you.
We have an episode on that.
Oh, awesome. I will be listening.
Oh, Nida, I love you.
Yes, we do. Yes. But you're so inspirational. Thank you for sharing your journey with us. Yeah. We're going to give away the book that you gave us, but I'm definitely going to pick up a copy as well, just to have on hand, because definitely be helpful in my practice.
Yeah. Thank you so much for having me, you guys.
Thank you.
I've loved listening to this podcast. I think it's awesome, and I think y'all are doing great things, and you gals sound like a good time, and if you're ever around where I am, you better give me a call.
Thank you so much. You're awesome.
Thanks so much, Lauren. Anything else that you want to say, like any plugs, anything you want to plug or you want to add?
Yeah.
How do we find you?
Yeah, so you can find me on at np.lauren. My blog page is www.laurenknob.com. And then if you want to follow the book account on Instagram, it's Pocket Past NP. And then, of course, every nurse practitioner should be following Nurse Practitioners of Insta at NPs of Insta, so that we can keep growing our awesome community and keep supporting each other's awesome careers.
Yeah.
So.
Cheers to positive NP experiences.
Absolutely.
We're all about that too.
Exactly.
That's right. We got to focus on those.
Yes.
Exactly. Our community is so important.
It is. Yes.
Continue to grow, and you're doing that. So thank you.
Oh, well, thanks again, Lauren. It was so nice meeting you.
Oh, thank you so much.
Good luck with everything.
Yeah. Thank you for listening. 4NP's podcast has a Facebook group called Nurse Business, a community created to support one another and enjoy positive ideas and thoughts. We hope you'll join us. In addition to that, for a little fun, follow us on TikTok.
Subscribe to our YouTube channel to see some clips of our live interviews and listen to past episodes. Feel free to email us with ideas for episodes, comments about our podcast, to recommend an interviewee, or if you'd like to be interviewed yourself at 4npspodcast@gmail.com. That's the number 4, npspodcast@gmail.com.
Please follow us on Instagram, Facebook, and Twitter at 4NPs Podcast. That's the number 4NPs Podcast. Subscribe to us wherever you get your podcast, and go to our website at 4npspodcast.com for episode transcripts, resources, and more information about us.
Thank you for listening. We hope you enjoyed our conversation as much as we did. Join us next time where we had such a fun conversation with Jill Cook, who is one of our favorite mentors. She taught us so much about the world of nursing and has been a huge inspiration for all of us. We had a great conversation and we can't wait to share it with all of you. Have a great week, and don't forget to check out our YouTube channel. If you like what you hear, please like and subscribe. The information in this podcast is for educational purposes only and should not be used in substitute for professional care by a medical provider. The information in this podcast does not represent medical or other professional advice or services. The thoughts and opinions presented on the 4NPs podcast are of the hosts and guests and do not represent those of their employers.